So I think we are going live now. So hi, my name is Katarina Stenko. I am within the enterprise division at Cytiva. And today I'm going to talk about, going to give a presentation called ID to Injection, Flexible and Modular Platforms to Optimize Your Manufacturing. And I will start sharing my screen. And I hope that this would be working now. So thank you for letting me be here and speak today. So if we're looking at mRNA, it can be a platform that can span from pandemic response to truly personalized therapies. But if you're looking at the scale, the different scales will have different manufacturing requirements. We have the pandemic response that would be very large scale and probably or localized manufacturing. Maybe the aim is there to produce 1 or 2 products in that manufacturing line. The other one, middle layer, would be for the infectious diseases and oncology. The characteristics of the manufacturing line is to actually handle very many products and that is very flexible to be doing that and also be able to scale out. Then you have the more personalized where we will see coming in the future year. I think we will see a lot of innovation in this area because you need to collapse the workflow into micro factories and to intensify the process. So setting up a GMP manufacturing, it takes time and you need to start invest early, maybe before you even know what's going to be produced in that manufacturing line. So this is actually what I'm talking about here. It could be general for all types of investments, but I'm using mRNA as an example. But what you should do is to stay informed, learn what's in the pipeline, and how to do the manufacturing. So, and what's very important is to know the quality attributes, because if you cannot measure it, you cannot manufacture it. So, and it's a good way of knowing that if you need to invest in a new QC testing or setup, for instance. And if you're looking at what scale should you still build your manufacturing line at, then you should look at the market size, the uptake, and also the dosing of your product and see if you can back calculate. Then you would get an indication on what scale would be good to play at. But also really important is to have work with flexibility, make it possible to grow. Rather start on the smaller side than build something that is too large and will be underutilized. If we are looking, at least me, for the last 2 years, I had to start looking at a total new universe of this field of mRNA. It's been like exploring and educate yourself in this new area. And this picture is sort of a way of visualize the different areas when we are talking about mRNA. You can start by separating mRNA into coding and non-coding RNA. And if you're looking at the coding galaxy, that's where we see the mRNA that we have seen in the vaccines, the self-amplifying RNAs. So they are used for vaccines, gene therapy, protein replacements. And in the non-coding galaxy, if I call it like that, it's where you have the small nuclear RNA segments that is working more on a gene level with a regulatory effect or functional effect. And these two processes are very different starting point. The non-coding one has the starting point is the oligosynthesis, and whereas in the mRNA field, it is the in vitro transcription that is an enzymatic reaction. Cytiva has offerings that is playing in both fields. We have a good legacy within the oligo processing, but my presentation will focus on the on the mRNA and the coding RNA. Just quickly to orientate you about the full workflow for an mRNA manufacturing process. It has 3 processes: the plasmid manufacturing, the mRNA manufacturing, and then you have the formation of mRNA and into lipid nanoparticles. And I will focus on the second and the third process in the rest of the presentation here. Hopefully, going in the future, we don't have to have the same urgency that we had the last years with the pandemic vaccines. And going forward, I hope that there will be room for more optimized manufacturing. But still, we need to go fast. And the question I often get is, there a fast route to go from lab to manufacturing? Well, I would recommend to focus on the molecule itself and the template and design. Is there anything in the molecule or the structure that would promote secondary structures, double-stranded RNA? So that could actually make it more difficult in the purification process later on. Try to design that away from the beginning, if possible, and spend time on designing your DNA template. Also optimize your IVT, your in vitro transcription, to avoid generating double-stranded RNA. If you're targeting, for instance, a specific tissue, you should definitely pay much attention towards the LNP strategy from the beginning. I would recommend you to do cost-driven decisions, especially around the reagents, enzymes, and consumables, to gain time already from the beginning. And also important, know the limits of the manufacturing equipment. We often get questions around temperature and solvents. It's easy to do things on the lab bench, but when you're going into manufacturing, it's often the temperatures and the solvents that sort of become a little bit cumbersome when you are in larger scale. And also think big from the beginning, because it's really costly to go back and change in the afterwards. So develop your processes with manufacturing in mind already from the beginning. And if you're looking at the mRNA manufacturing, and especially if you're looking at the beginning of the process, there are 2 different ways to do 5' capping. The cap is there it's a chemical structure that sits on one end of the mRNA to protect it from degradation, but also promote translation. And there are different ways of doing it. You would have, and the way you will have the enzymatic capping or the co-capping. And the way that you are doing it will really have an effect on how your manufacturing would look like. It will also have effect on the batch cost and the throughput of your facility. What I put up here is 3 scenarios where, and it's the process before the lipid nanoparticle formation. And I also assume that you have a 2 chromatographic step process. What I'm showing is a system set up for an efficient manufacturing. But if you're looking for the first one, it's the co-capping. It's a 1-pot reaction. The second one is an enzymatic capping, where you have a TFF at the filtration step in between the 2 enzymatic reactions. And also you have on the third process is where you also need a capture, an affinity capture step in between. So I'd say that the same system here, if you have a flexible manufacturing line, you could use the same system in multiple places. And also with the single-use flow path, there is this possibility because you don't spend time on, or less time on cleaning and changeover. And in the next slide, I will have translated some of these into number, the effect of having these different setups. So if I'm looking at the different scenarios, there will be, there are differences in total process yields and output per batch. You would see that with the co-capping, you often get a little bit of lower titer from the beginning, but it's a shorter process. And with that one, you get a higher total yield. But also having less steps means that you have less unit operations in your, you will have less cost spent on plastics. Enzymatic capping gives a little bit higher yield from the beginning, but it's a longer process, and hence you get a higher cost. So it's a balance of what fits best, and also the process time. So you just don't look at the yield on the individual unit ops. You have to look at the overall yield and take in all these aspects into considerations. You also have the cost of reagents, and considering if you need to have licensing or IP for one or the other reaction. So, and of course, you need to look at the security of the supply. And if you're looking at the process downstream of the IVT, the in vitro transcription, there is today a lot of diversity. It's a very, I would say that there is not one platform process. We can offer a platform equipment setup, but we do see that there is a high variability right now on how to purify your different mRNAs. And that is really dependent on the length of the cousin strap and the sort of also the three-dimensional structure of that one. Because again, this molecule, an mRNA molecule, can span from a couple of hundred nucleotides up to 20,000 of nucleotides. But again, if you have a very flexible equipment setup, there is ways to actually be able to be that flexible manufacturer and produce multiple different products in your facility. So to reach your manufacturing goal, you can either scale up or you can scale out, or you can do for mRNA, you might have to consider both in different steps of the process. So again, the greatest flexibility you will get with the single-use equipment, where you have a single-use flow path that you also can size depending on the scale of your process. And if you're looking at process development, you might not have single-use equipment, but there is also an important thing to think that you should have equipment that makes it easy for you to transfer methods from the process development into your manufacturing, GMP manufacturing. So actually, this is a question that I encountered from our customers. So that had a little bit of a different scenarios. They had one main product that they wanted to produce in the 10-liter scale, but they say that, oh, I want to produce, sometimes I will have a smaller process coming in, or I might have to, if one of these are a success, how far can I scale up within my manufacturing line? So we did a little bit of a basic calculation. We said that we need to optimize around where you should run your most batches, and that was the 10-liter scale. If I'm talking about the IVT starting point, and then we did some different scenarios on how it would look like if you were going both up and down from that one. So in most cases, actually the 10-liter equipment setup works very well in both. It could be in some of the unit ops where you did have to run at non-optimal conditions. But it would still work very well. So my takeaway is here that you should invest in a scale that can flex with your needs and actually go for maximized utilization of that manufacturing line. And if we are looking at the LNP formulation, it's also here also important to design and optimize to ensure that you have scalability, and also that can and go with a provider that can actually work with you from the beginning when you're doing your discovery to validate your molecule and design your formulation to get target towards the right correct tissue. And then you need to have equipment that can, so you make sure that you can maintain that quality and yield as you are going up in scale. And I would say that this optimization of the LNPs will become more and more important as you're developing product that is not only for vaccines, but targeting maybe specific therapies at a specific tissue. And for LNPs, Cytiva is partnering with our sister company PNI to support us in this area with equipment. And when you have formulated your lipid nanoparticles, you need to consider your filling. So here we have two platforms that are highly agile but also very robotic systems. We have one that is focusing on the personalized area, that is one batch, one patient, and these are targeting really the neoantigen cancer vaccines, and it is allows for multiple patient batches per day. The other one that we have is the one that is a little bit more scaled out. The same kind of automated concept is used to handle a high number of different products. It fits very well into a facility with multiple products and into the targeting towards the different infectious diseases. Again, it can be a strategic fit to own your own filling line to accelerate the advancement of your product. So Cytiva can support the full mRNA manufacturing, all from unit ops to full end-to-end solution. Our manufacturing platform is designed around a process examples where we have worked in as much flexibility, both in titer, in yields, and to see that it can flex and to fit with different scenarios. And if there is a need, we put that together in a total platform with different industrial automation can be supported, included, and also consumable support and enabling services and training if you want it as a package deal. And also, if you are in the need of a new manufacturing suites, we have a modular facility solution that can include the full process, including also the lipid nanoparticles formation and the filling. Starting with in a new lab can be beneficial for the mRNA, especially considering that it's really sensitive to RNases, and therefore it's a good way of starting in a new facility or new suites. Also, you should consider that for mRNA, considering that this process is very short, it doesn't include any cell-based upstream where you actually have a cell culture that should be running for several weeks. The in vitro transcription enzymatic reaction, it takes hours, which means that you have a very short process. You can manufacture essentially one batch in 1 week. And that means that you have the possibility or potential to get a lot of batches in a year. And even if the scales, even if you are at 10-liter scale, you get a lot of doses out, and all these needs to be released, these batches that you are going to do. And it's the same requirements as for any other drugs. So it can be quite a lot of paperwork, and also you need to handle the data coming off those machines. And for that one, we have designed a central historian where you can store your data, and you can actually access it from outside the suite. So you don't have to go up and get your data off the machines. You get it, so you can reach it from outside the suite. And we include reporting tools, software to support the regulatory compliance, but also sort of gives you ability to do process analytics and also connect to other digital solutions such as LIMS system, MES systems, and so on that would support your manufacturing. So if I were to give you some advice on how to set up your manufacturing, I would say the blue boxes here is more towards the one that is working on the development side. So I would say that set your goals at the plasmid design. Do spend time on it, work on the plasmid, make sure that you can design it to avoid double-stranded RNA. Look at the exposure of the 5' end, so it is so you don't have to denaturate your RNA before enzymatic capping, for instance. And also design for manufacturability. Learn what can be done at different scales of the process and design protocols that are scalable but also easy to transfer into manufacturing. And if you're looking at the green boxes, you might be more of a manufacturer. So there, if you are on that side, you should prepare for flexibility and evolution. You should invest in a flexible manufacturing line that can sort of adapt to different manufacturing needs. Know the performance of the equipment, but also if you are a CDMO and so challenge the scientists or the clients on the process a bit, because they need to do something that is possible to put in your manufacturing line. But also have a very holistic approach. Look at how would I get my plasmid template in? Should you invest in having the capacity to take a full end-to-end solution or manufacture that, having the plasmid and all the way down to filling and finish, and have a strategy for data management, because this is a lot of data coming out of your manufacturing that needs to be put into batch reports and so on. So I would start wrapping this presentation up. I do look forward to see how the mRNA technology will evolve. I hope that we can have less urgency in the future and have more focus on the efficiency, the manufacturability, and actually the process economy. This must be considered, and it will also be a very good factor to drive innovation in the future. So consideration when you're developing a process, so think about manufacturing really early. I would have keep a platform approach, keep the flexibility and speed by using standardized solutions, and a modular approach and parallelization and a holistic offering will cut timelines. And there are scalable solutions available all the way from the unit up and into full end-to-end solutions that will support and allow your manufacturing to grow and also support an increase of capacity. And thank you for listening. And I don't know, I think it's time for some Q&A now. Okay. So I think that was it. So thank you for the presentation. So really have a good day, and thank you for listening to me today. Goodbye.
Finish. Thank you.